been about 9 new cases in Queensland. What does that tell us about how difficult it's going to be to get to those final thresholds of the roadmap and people who might think they're too high?
I just want to. I know there's been a bit of commentary about that, but this is the key point. Is this? Like, and it's very easy for people to run commentaries about, oh, this is not a suppression strategy. You're trying to eradicate it. That's absolute nonsense, because an eradication strategy isn't just getting to zero; it's staying at zero. And the moment you get one case, you lock the whole place down again. Look where New Zealand is at. That's not the strategy. But in order to have confidence, and just think, this is just absolute logic. In order to have confidence that you can keep numbers low for the long term, you need to get numbers low as you possibly can. And then you can have some confidence that off that very low base, particularly as it relates to community transmission mystery cases, logic just tells you you're always going to have a better chance of keeping it contained if you've truly contained it. But the sort of New Zealand strategy, that isn't just about where you get to, it's about what you have to maintain. And the sensitivities there, the tolerance is pretty well zero. So that's why when they get a very small number of cases, they've got lockdowns back on again. I'm not criticising them, but that's a different strategy, a different setting. That is not the National Cabinet decision of our country. And I'll refer you to the Prime Minister's comments only a few months ago that very low to no mystery cases was a critical component, a very important component of the National Cabinet strategy.
Are you able to confirm today that it was in fact police who asked you to impose the curfew?
No, I wouldn't confirm that at all. I think there was a discussion. There was a discussion between different parts of government. We spoke with police, absolutely. Police, I think,
where did the idea first come from?
Well, I think.
Who first proposed it?
Oh, look, I'm not wanting to be anything other than clear, but I can't pinpoint the individual and the day when they said, "Oh, let's do this." I think there's been an ongoing discussion, right? Just to be as clear as I can be, there's been an ongoing discussion. Every time we make rules, police will give us feedback on how hard or easy they'll be to properly enforce. And you would expect nothing less, that we have that ongoing discussion. Once you limit the number of purposes, the number of reasons that you are allowed to leave home to a very small number, then the easiest thing to do to enforce that, not easy at a personal level or, we've never done it before, but the easiest thing, just if you be completely focused on the kind of operational side of it, the easiest thing to do is to say, OK, well, if you haven't got one of those reasons, you're not allowed out. So at the moment, if you wanted to go exercising, you can't. If you wanted to go shopping, you can't. If you go to work, you can. If you're a permitted worker, you can go and do that. So this is about limiting movement. The health advice says limit movement. Police say they need clear rules to be able to enforce. Curfew delivers both.
It's such a radical step for Victoria.
But a very, very effective one, Laurel, because it has limited movement, and that's what drives down case numbers.
Do you not think Victorians deserve to know where that idea originated from and what the process was?
What I'm saying to you is I can't give you a specific person and the exact moment that they said, let's do this.
You won't tell us.
No, it's because I can't tell you. I don't know exactly which person at what moment said that. But there's ongoing discussions, lots of different people talking, both us as a government, officers, so senior officials, members of Victoria Police. It's no more or less complicated than that.
Did Brett Sutton advise you that you should do it?
It's not a matter for Brett Sutton. That's not a health advice. That is about achieving the health outcome. His advice is do whatever you can to limit movement. Police then say we need rules we can enforce. It needs to be as simple as possible. We can't stop every car, but if everyone who's out that shouldn't be knows that there's a chance they'll get caught and they've got no lawful reason to be outside, that's what a curfew is about, then all of a sudden you will limit movement. So it's consistent with the health advice. These are decisions ultimately made by me. So the answer to the question is, if anyone has got a problem with that, anyone who doesn't think that has limited movement and driven down cases, well, then their argument's with me. Because I've made that decision, because I think it's a challenging one to make, but it's effective and it works. And what it means is, if you wanted to go exercising at midnight, you can't. If you want to go shopping at midnight, you can't. If you're a worker and you're permitted, you can. If you need urgent care, you can get that care. Beyond that, what it means is no one's sneaking out going to their mate's place. No one's going and doing things that they are by law not allowed to do. So it hasn't changed the rules. The rules, that is, the reasons you can leave, they're all the same. It just makes the job of police much, much easier.